Let's talk about this amazing herb called ashwagandha.
People who like it love it, but some warn that we don't know enough.
But if you're going to take ashwagandha,
Ashwagandha.
Well, there's one herb again, it's ashwagandha.
If you aren't taking ashwagandha yet, you must be stupid.
Ashwagandha, a plant used for thousands of years in traditional Indian medicine, has recently emerged as a modern-day superherb with many health benefits. Also known as Indian ginseng or winter cherry, it has captured the attention of bodybuilders, athletes, university students, and even professors. Native to Africa, the Middle East, and India, this evergreen shrub primarily utilizes its root in traditional medicines. The name ashwagandha itself, derived from Sanskrit, translates to smell of the horse, a nod to its distinct natural aroma and its reputed ability to impart strength akin to that of a horse. But what exactly is ashwagandha? What is ashwagandha? Ashwagandha, scientifically known as Withania somnifera, is a powerful adaptogen with a rich history. Adaptogens are a unique group of herbal ingredients known for their ability to help our bodies manage stress. Unlike many other substances, adaptogens work to balance bodily functions, bringing them back to equilibrium in the face of external stressors. However, many more benefits are being found from this adaptogen, leading to its popularity in Western society. Lowers blood sugar and body fat. Starting off, ashwagandha has shown promising results in reducing blood glucose levels and triglycerides, a common form of fat in the blood. Clinical studies have demonstrated its efficacy, with one study revealing that participants taking ashwagandha experienced a significant decrease in blood sugar levels, comparable to the effects of certain type 2 diabetes medications. While not clinically proven yet, it may offer an alternative to those struggling with fat loss and diabetes, which typically go hand in hand. But one of the most celebrated benefits of ashwagandha is its ability to manage stress and anxiety. A notable study proved these effects. This study was a randomized, double-blind, placebo-controlled trial that involved 64 individuals with a history of chronic stress. Participants were divided into two groups, with one receiving a placebo and the other 300 milligrams of high-concentration, full-spectrum ashwagandha root extract, administered twice daily for a total of 600 milligrams per day over 60 days. The results of this study were quite remarkable. The group taking ashwagandha showed a significant reduction in stress assessment scores, a clear indication of its stress-relieving properties as measured by standardized stress assessment questionnaires. Furthermore, a key indicator of stress, serum cortisol levels, were substantially reduced in the ashwagandha group compared to those receiving the placebo. This biochemical evidence further cements ashwagandha's role in effectively reducing stress. In terms of safety and tolerability, the study meticulously monitored for adverse effects. It was found that the side effects were mild and comparable in both the ashwagandha and placebo groups, with no serious adverse events reported. This highlights the safety of ashwagandha, making it a viable option for those seeking natural stress relief. And there is more. When we mentioned the bodybuilder's interest in this supplement, it was for a good reason. Increases muscle strength and size. Research indicates that ashwagandha can enhance muscle size and strength. A study focusing on male participants who took ashwagandha supplements while engaging in resistance training showed remarkable results. The participants were measured using a bench press and leg extension exercises. After the experiment and training, the participants taking ashwagandha experienced accelerated muscle hypertrophy, particularly in the chest and triceps, and a reduction in post-workout muscle damage. This makes ashwagandha a potential supplement for athletes and fitness enthusiasts, and explains why many bodybuilders are flocking to it. Improves sexual health. Today, one of the more striking health issues is men's sexual health and fertility. With average testosterone levels declining over several decades, the difficulty of producing a child is increasing. However, a recent study reported that 14% of the male participants' partners became pregnant following a supplementation protocol using ashwagandha. In women, ashwagandha has been shown to aid in sexual dysfunction, making it beneficial for both genders. Ashwagandha's impact on sexual health has long been advertised to improve fertility fertility by enhancing reproductive hormone levels, thereby increasing sperm count and quality. But it wasn't until recently that studies started to prove these statements. Focus and mental health. Finally, we cannot talk about this supplement without talking about the benefits that extend to mental health as well. A study involving 66 individuals with schizophrenia who were administered 1,000 milligrams of ashwagandha extract daily for 12 weeks showed a significant reduction in symptoms of depression and anxiety compared to those on a placebo, with these powerful effects to reduce potential psychological conditions and also reduce anxiety and depression. This herb has the potential to help many people reduce their suffering. Today, in times when depression and mental health are so often talked about, having a resource to help you get through the day and perhaps even improve your outlook could be a game changer. Side effects and considerations of ashwagandha. While ashwagandha is celebrated for its numerous health benefits, it's important to be aware of its potential side effects and considerations for safe usage. The long-term effects of ashwagandha have not been fully studied, and its use can lead to some short-term symptoms. These may include stomach upsets, diarrhea, and vomiting, especially when consumed in high doses. To reduce these symptoms, it is recommended to use lower dosages. In addition, to maintain its efficacy and prevent the body from becoming accustomed to it, it's advised to cycle the use of ashwagandha. This typically means taking it for a period, such as up to 3 months, followed by a break for a few months. Cycling helps ensure that the body responds effectively to the supplement over time. Our body has powerful mechanisms to downregulate receptors over time in response to an increase in any form of signaling. This can be both from internal factors like stress and external factors like taking a supplement often. Despite its natural origin and historic use, ashwagandha is a potent herb, and its interaction with various medications and health conditions should be considered. Therefore, consulting with a medical professional or doctor before starting any supplement regime is highly recommended, especially for individuals who have not taken it before or have pre-existing health conditions. Pregnant women, in particular, should avoid taking ashwagandha as its effects during pregnancy have not been thoroughly studied. Additionally, those with autoimmune diseases such as rheumatoid arthritis, lupus, or Hashimoto's thyroiditis should be cautious, as ashwagandha can stimulate the immune system. And there you have it. From reducing stress and anxiety to improving muscle strength and sexual health, ashwagandha's potential is backed by scientific studies and traditional use. When used responsibly, it can be a valuable addition to one's wellness routine, offering natural support for both physical and mental health. If you found value in today's video and are eager for more insights, check out our video on the surprising benefits of creatine and how it can supercharge your mental well-being. Finally, thank you for taking the time to watch this video. Remember, you have one life. Make sure it's a healthy one. See you in the next video.